Hey everyone, this is Robby for another Manual Monday, and today I want to answer a question that's very commonly asked, and I see a lot of people inquiring about in regards to sciatica and radicular pain that's stemming from the lumbar spine. And I want to show today a treatment technique we use that's probably one of the most effective treatment techniques in regards to treating sciatica, radiculopathy, and that means pain radiating from a central root, which is normally the lumbar spine. And today what we're going to do is show you a functional dry needling technique that we use that is the most effective technique that I've seen in centralizing or bringing pain out of the lower extremity and centralizing that pain from where it came from. So here we go. Okay, so here what we're going to do is functional dry needling. So our goal here is to affect the segmental level that is radiating down the lower extremity. Now you got to think about it. When you have a dysfunction at the spinal segment, you're going to get issues down the chain where those nerves travel. So it's very predictable in terms of identifying the spinal segment that's a problem based off of the symptom presentation down the lower half. So today what we're going to do is we're treating the lower lumbar segments and this radicular pattern down the left lower extremity here. So we're going to hit the L3, L4, and L5 spinal segments. So in doing so, what I'm going to do is I'm going to actually palpate the spinal segments that I'm looking to affect, and that's going to allow me to place the needle exactly where I need it, and then we're going to insert right into the muscle here, and then we're going to do the same thing on the other side. And we'll insert the needle directly into the muscle there. Alright? Alright, so that would be your L3 spinal segment. And then we're going to go between L4 and L5 here. Right there, you see that? There. And there. Alright. And then what we'll do next is we'll do a little intermuscular stimulation. And now you can imagine if you have your spinal segments here and you have this muscle, and you're talking about core muscle, is a muscle directly affecting and surrounding the spine. So when this stimulation is working, it's mobilizing those vertebrae segmentally, so segment by segment. So you're getting actual motion where you get what becomes stiff and stuck after an injury or after inflammation has been present for a period of time. And then you're innervating deinnervated muscle that's just shut down basically due to either that's the origin of the problem or it's in response to an injury or the problem being present for a long time. And so what we'll do is we're going to provide stimulation, and we have it separated between left and right here. So we're going to get the left side going first. Tell me when, Sonny. Alright, and now the right. Is that good? Alright. And so we'll let this sit anywhere between 5 and 15 minutes, depending on the patient and the situation. Obviously you can tell here with Sonny, he's been receiving some care. We've been working on some soft tissue mobility and some different things. You can tell he's got some marks from some of the cupping that we've been doing. but this is a really effective treatment technique, especially for people that are in a little bit of an older population, 40, 60 years old. It's probably one of the most effective treatments in regards to reducing pain and centralizing symptoms caused from lumbar problems. So there you go. Here's another Manual Monday. This is Robby. This is Functional Dry Needling, and we'll see you next week.